name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Welcome, everybody. Thanks so much for joining us on today's episode of Airing Addiction. I'm really excited for the episode today because we are in March. You know, if you're listening to this either live on Facebook or, sometime soon thereafter, wherever you get your podcasts, March is Social Workers Month. And so, we decided at Airing Addiction to take the opportunity to talk with some really important folks in the field of social work about kind of why social work and addiction are connected. What does it look like to provide work for substance use disorders in multiple settings, and why it's important to be connected to addiction and substance use in the field of social work. So with that, I'd like to introduce our panelists today, like our attendees today, and we have Dr. Taylor Hall, who is an assistant professor at Bridgewater State's University School of Social Work. Lots of fantastic experience, and I'll let you share what that has been like when we ask some questions of you. And we also have Amy Kasik, who's a licensed independent clinical social worker, who is one of our clinical supervisors here at Spectrum New England Recovery Center in our Southbridge outpatient program. And so with that, I'll start with you, Taylor. Do you want to share just a little bit about your background and kind of how you chose the path of social work for your career and what that looks like for you?
Yeah, sure. So I didn't always know that social work was the field that I wanted to go in. I think that I always had this passion for wanting to change systems or change people's sort of opportunity and life experiences. Grew up around a lot of substance use and sort of co-occurring mental health issues, and couldn't really figure out like what field that looked like. Unfortunately, I wasn't super connected to social workers growing up, but when I did go to college, I eventually chose to go to college, and I thought that what I wanted to do was teaching. So I'm still kind of in teaching, but I had started in elementary ed in Spanish, actually. And so it was my advisor, after I was sort of, connecting with her and saying, these courses are great, but it's not necessarily getting at what I want to do. Like I had done my teaching practicum in a kindergarten classroom, and that was a really interesting and challenging experience, but it just wasn't like lighting my fire, I guess you could say. So it was then when I started to explain to her, like, I really want to connect people to resources and support, and I want to change the way we do things, because I can see that there are a lot of gaps in the services as they currently are set up, based on my lived experience and based on the lived experience of people in my family and in my community. And so it was then that she was kind of like, I think that you want to do social work. So I was a junior in college. And so there's this like sort of parallel process of, do I want to just get out as soon as possible because I only have a little bit of time left, or do I want to explore this new career trajectory? So I started taking social work courses and eventually really understood and felt like that was a good fit for me. So that's when I started to pursue social work, was several years into my undergraduate degree. And so my piece of advice to all my students and just people is, if it doesn't feel like a good fit, like, it's okay to change. You never have to, keep going on a path that doesn't feel like it's working for you. So that's what got me into social work, is really just having someone, a mentor, help to identify for me what connecting me to the career path of what I wanted to do, what I was verbalizing, what I wanted to do. And so from there, when I left undergraduate, I worked at the VA. I worked at Suffolk County House of Correction. And in both of those practice settings, it was really clear that substance use played a large role in the challenges that people were facing, and that we weren't necessarily well equipped to deal with that. And this was, like almost 15 years ago at this point. So there's been a lot of change, but obviously we still have a ways to go. But that's how I first got into social work, was really thinking about the ways in which people in my life, in my community, could have benefited from social workers and the work that we do, but just not necessarily seeing it and having that passion to really be able to get there and to help to connect people to those services. Sorry.
Thanks. And Amy, do you want to kind of share your perspective too about kind of what brought you into social work similarly?
Sure. It's actually remarkable how similar some of our experiences were, Taylor. I don't know that I ever really chose social work. I think it was just always something that I wanted to do, but I didn't know it. For me, I always knew that I wanted to do something that would help people. And I knew that there were supports out there that some people maybe needed, but weren't connected to. And I thought that would be something I'd really be interested in doing. So for me, initially, it started out where I thought I was going to be a teacher. And I started taking courses for English and history and kind of realized I don't actually think I want to teach. That's not really hitting at what I'm looking for. And so I started taking more classes that interested me in psychology and sociology. And that was more up my alley. I joined a peer counseling hotline where we were having other students call in on the college campus, and we learned some techniques in counseling, and I really enjoyed that, but still felt like there was something missing. And so I was talking with an advisor, and he said to me, I think what you're looking for is social work. And so I opened up the course catalog and looked at the social work courses and just knew right there, yep, this is what feels right. And as soon as I sat in the first class, I knew that I was where I belonged. So it was, for me, I think it was my sophomore year of college where I realized this is what I want to do. And so I applied to the School of Social Work and kind of felt like that was the best fit for me. I never really had a specific population where I said, this is exactly who I want to work with and exactly what I want to do. But I always was interested in forensics and the court system. So when I got out of grad school, I started working with foster care and adoption and doing some kind of like family court service work. And that was really, really interesting. I did that for about 6 years, and substance abuse was certainly impacting every layer of that work, the children, the families, the parents, the system as a whole. So I did that for about 6 years and then kind of felt like, okay, this is really intense. I'd like a change. So I started kind of going back to my roots and thinking again about forensics, and ended up working at Worcester County Jail and House of Correction. And I absolutely love that work. It was really, really fascinating. And one of the most interesting things that I noticed was that we were seeing more mentally ill people in the jail setting than I had seen in the community. So it was really an interesting way to learn about different mental illness and different forms of treatment, and also some just systemic gaps that as a social worker, I couldn't help but notice. And you see sometimes the same people who come back in, and then they get released and then they come back, and really some of the underlying issues are never addressed. And substance abuse was certainly one of those things that, is chronic, and people need to be connected to treatment, and treatment needs to continue. So when I was getting to the point of moving on from the jail, I thought at that time that I wanted to work with veterans. And I realized that one of the areas that I needed more training and education was substance abuse treatment, especially if I was going to work with veterans. So I started doing some research and kind of looking around as to what was out there, and just trying to educate myself and learn about different treatments. And that was how ultimately I got connected with Spectrum. And learning more about methadone treatment and Suboxone treatment, everything just kind of connected. And I started to realize, oh yeah, I didn't really know anything about this before, but it really makes sense. And this is something that I'd really like to be a part of. So for me, it was kind of a roundabout journey. But definitely in all the fields that I've worked in social work, substance abuse has been a prominent issue at every agency.
Yeah, that's one of the things I always say to my students, right? They try to avoid sometimes like, I don't want to do substance use work. And it's like, no matter where you're working, there's going to be an overlap there, whether it's DCF, whether it's schools, even if you don't think it's going to be a piece of what you're working on, it is really actually a layer to a lot of the situations that people are facing.
And Taylor, I'd love to talk more just to build on that, right? So, I've been doing this for a really long time, and I think a gap that has existed for a while, and I'm a mental health counselor, right? Not a social worker, so I'll put that right out there, but lots of love and appreciation for social workers, this month and every day. But in regardless of your kind of clinical pathway, right, in human services, there has historically not been a lot of education specific to substance use disorders, right? So folks will kind of take, either social work tracks that are clinical, or mental health counselor tracks that are clinical, and you'll get lots of, introduction to the DSM and lots of introduction to mental health, and maybe one class that's an elective that maybe only covers a small amount of what, substance use and disorders and addiction are. And I know that that's starting to change, and I think that you're a big piece of how that's changing. Can you tell us a little bit about what's happening at Bridgewater State and what work you've done?
Yeah, sure. There was a study that was done, I want to say like 4 or 5 years ago, that looked at social work schools and their courses on addictions. And I think it was like 8% of social work schools have a course on addiction or on substance use that students have to take. There are many programs that don't have any courses that solely focus on substance use or addiction. And then for the schools that do, to your point, many times it's like an elective. So if students have a special interest, then they'll be able to access that. But it might be one course, and maybe, if you can only fit 18 students in a course, there might be an overload of students who do want that content and are never able to get it. So since I've been with Bridgewater State, we were able to obtain a grant from the Council on Social Work Education, CSWE. That was a practitioner education grant for substance use disorder practice. So we were able to get all of this curriculum, all of these resources, simulation trainings, opportunities for our students to present research. But what this grant funded was a course solely on clinical practice with substance use disorders. In addition to that, we have a macro level practice course on substance use as well, really thinking about policy, macro level interventions, how to connect with your legislators around supporting substance use and misuse in your community. So that's one thing that we've been running for several years now. And every semester we run it, there's always a surplus of students who wish that they could be part of that. And so part of the struggle is, again, like you're saying, finding practitioners who are able to come to the school to teach this content, because there is a great interest, I think, from students as they start. A lot of these students have lived through the opioid epidemic, have been impacted. You're hard pressed at this point to find students who haven't been impacted by substance use in some way. And so whether or not you want to work in this field, there is at least that interest of, I want to know more about this because I need to help explain some of the things that I've been through or my family and community have been through. Secondly, the RISE Foundation has funded us starting last year for a 2-year harm reduction training program for our social work students, where we are integrating harm reduction content, perspective, and approaches to substance use treatment, starting with our students. We're also working in collaboration with their supervisors. So there's this parallel process of students who are working in the field, their supervisors, and really starting to think about how can we approach substance use, not from this all or nothing perspective of you're either abstinent from drugs or alcohol or you're not, but this continuum of risk and this continuum of reducing harm, right? So if you're injecting every single day, how can we decrease that? Or how can we make sure you have clean needles and supplies to reduce your risk of HIV or hepatitis C transmission, things like that. So the goal of that grant is to really create this grassroots level change from students, their supervisors, their agencies, and then hopefully the community to start to think about how can we change our approach to substance use, where it's not all or nothing, but we're not saying to somebody you have to be abstinent to receive housing or mental health services or our support, but really saying we're going to meet you where you're at because we understand that that's the reality of substance use disorder, and that we'd rather have you connected to us in services than in isolation without any of these supports.
And I really appreciate, that transition and that perspective, right? Because I think it fits in well with social work, right? Like folks that do kind of more medical social work support have been doing that kind of approach for a long time, right? Whether it's diabetes management, reducing harm, supporting people kind of where they're at, in all of their psychosocial needs, it's not an unfamiliar concept to social work in general. It's that stigma that comes along with addiction that really kind of lends itself to that all or nothing mentality, right?
Yeah.
You're abstinent or you're not.
Yeah, I mean, we use like sunscreen to reduce the harm of the sun, and we use seatbelts, right? And like all these sorts of things. So we engage in harm reduction in our everyday lives. And it's just like you said, the stigma and the shame that's associated with substance use that really makes it difficult for people to kind of think about applying it to another situation.
I think it's a great opportunity to teach kind of from the beginning, kind of combating that stigma, right? Just providing that education is training the next generation of clinical staff that will be working either in the field directly because it grabbed them for whatever reason, or they followed that path or landed there, which happens to many of us. Like many of us didn't intend to, but we realized just how either important it is, how rewarding it is, right? And never leave substance use. I think that's a common thing once you get there, once you're exposed. But it gives that exposure, right, at that level. And also, I wonder if you can speak to ways in which you, in your courses, combat that stigma, whether it's around language or content, in teaching kind of what does substance use disorders really look like, and how we talk about them makes a difference.
Yeah. So one of the first things I do in my substance use focus classes, and a lot of the other classes too, is that I pull up the Words Matter pledge from the Grayken Institute of Addiction. I don't know if you've heard of that. But yeah. So just really thinking about stigmatizing language that prevents people from talking about their substance use, misuse, and accessing treatment. So, that's something that we can do first and foremost, is kind of think about, okay, I don't want to use certain stigmatizing language about people who use drugs, right? So really leading with person first language, trying not to use stigmatizing terms around addiction, and really starting to think about using language that promotes the dignity and worth of a person. Secondly, in the clinical focused substance use disorder class, the midterm project is a self-assessment on our own biases. Like, where did I get these beliefs about addiction, right? Like, where did I start to learn that people who use substances are somehow less than? When did I internalize that? Is it from DARE? Is it from my parents or my community? Was I stigmatized because my parents had a substance use disorder? Is it the criminal justice system that says, you're a bad person if you engage in substance use or misuse? So really going through and thinking about what are my personal biases around substance use, and how am I going to mitigate that when I'm in the field, and the way I talk about substance use, the way I talk to people who are actively engaged in substance use, are looking to me to be that person of support. So depending on the way I'm talking about those things and my past experiences with and around substance use, I am potentially transferring some of those beliefs and biases to my clients. And, that's what we want to avoid. There's a history of social workers and other helping professions actually being very harmful to people in communities that need assistance and support. So how can we be actively engaged in a process of self-awareness and humility around substance use and our own beliefs and internalized processes?
Such a great point, because that's really what perpetuates stigma, even if it's not very purposeful, right? It's those beliefs that kind of come across when you're interacting with your communities, whether it's your medical staff, your social work staff. And if folks want to hear more about the Words Matter pledge, so we adopted it some time ago. I run all of our orientation for any staff entering, a clinical position at Spectrum Mentoring and Recovery Center. And we just, why reinvent the wheel? We just adopted the Words Matter pledge, and everybody pledges that. And I think it's been about a year now, time flies. On this podcast, we did have Julie Burns from RISE and Dr. Miriam Kamaromi from the Grayken Center doing an entire episode on why language matters. So folks, that kind of grabs folks in any way. You can't say it enough, so that's why I bring it up here, but you can kind of dive into a full podcast on what that looks like and what person first language can really make an impact. And so that brings me to something I wanted to talk to you about, Amy. And of course, you being part of our team, I know where you work, I know what you do in detail. And one of the most stigmatized treatments for substance use disorder is medications, and it's prevalent even in helping professions, like we talked already a little bit about. I just recently did and one of a multiple part training series working with clinicians who work predominantly with children, right? And children in with trauma history, so often in child custody and in foster care and things, and the same questions come up every time, right? As I'm providing kind of education about medications for opiate use disorder, for alcohol use disorder, is kind of why does somebody have to be on it so long? Why isn't this a short-term treatment? And can you tell me a little bit, Amy, about kind of what you learned, kind of as you kind of landed into kind of medication treatment in your social work practice?
Yeah, absolutely. I think what I learned most obviously is that it just makes sense that treatment would take some time. When we think about how long it takes for someone to develop a substance use disorder and kind of be in the throes of addiction and then get to a place where they realize, hey, this isn't working for me. I need something. I need some treatment. I need help. And then they ask for help. That's a long time. And a lot of things happen in that period of time. So when people come into treatment, we wouldn't expect them to all of a sudden just be better just because they walk through our doors. We wouldn't expect that anywhere. If someone had a medical issue or a mental health issue, we would expect that we would take some time to get to know that person and assess what their strengths are and really look at what else are their needs. But the first goal is always to stabilize them. And so the medication can help us start to do that and start to help them feel better. Once they're more stabilized in that way, then we can really look at what are some of the contributing factors that led to the substance use disorder, and what are some of the behaviors or the thought patterns or things that you have or you do that continue to contribute to it. Even if you have been sober for a short period of time, you might still have some behaviors that are risky, and that put you at risk for relapse or for other things that might not be optimal for recovery. So being able to take that time to really look at it and then learn some new skills and then practice new skills. Why would we expect anyone to be able to just all of a sudden do these things that they've just learned? And maybe there are things that other people have learned throughout the course of their adolescence and their development. But if you've been affected by a substance use disorder, you may not have had the chance to really grasp those skills or master them. So it's about relearning other ways of being. And why would we think that people would just be able to do that, right? It takes some time and it takes some practice and it takes feedback. And none of us are perfect. So sometimes there's mistakes or bumps along the way. And then we use those as opportunities to learn and take that information and move forward. So if you really think about the amount of time it takes for people to develop habits and develop the substance use disorder, it just makes sense that treatment would also take some time. And just recognizing that we can support people throughout their journey. It's not just here's where you start and here's where you end. It can be a lifelong journey. I mean, none of us are ever done learning or practicing or growing. So if we apply those same thoughts, I think it just makes sense that it's going to take some time, but we really see people grow and change. And by the time they're really in a great place in their recovery, sometimes we have to think, like, what else do you want to work on? Because you've made so much progress. What are some areas that you'd like to grow in that maybe aren't directly tied to your substance use, but other areas of your life, like your financial situation? I mean, we have patients who are working on improving their credit score because they'd love to be able to purchase a home for the first time. That's a really great goal. And that's something that they're able to start thinking about while they're in treatment and mastering some other skills. They're building other areas of their life to really support long-term recovery. And these are things that just, they don't happen overnight. And that's okay. We wouldn't expect that from anybody.
And there's no reason to remove it, right? Like, so that's one of the other points I always make, like, when we're really putting, substance use disorders in the space that it belongs as of a chronic brain disease, right? We don't have those conversations, about like, well, how long are you going to be on this insulin? Right, that is managing and regulating your blood sugar, and you might need that long-term, maybe forever, right? And so, medications for opioid use disorder, for example, are really not that different for how they're managing, how your opiate receptors are responding in your body. It's really not that different, right? It's they stabilize, managing any withdrawal symptoms, and managing any craving, kind of keeping that and allowing that brain repair to actually happen, and build those new pathways that you're talking about, Amy, and building that new learning, right? Allowing that to happen. And there's no other medication that we have those conversations with people. Of course, in general, with medications, you want to always have the conversation, right? What's the lowest possible dose that's most effective for you, and what is this part of your long-term plan? We have those conversations, but it's not geez, you've hit X time. I feel like it's time that you need to move on without this.
Yeah, change is hard. I mean, that's one of the things I use to combat stigma and bias in classes. Maybe there's a change you've been wanting to make. Maybe you want to eat healthier or go to the gym, right? Or read more or whatever it is. And like, what's preventing you from doing that, right? It's the same process that we get stuck in our habits. And if change were easy, then everyone would do it. So you can really just apply that perspective to substance use or other things.
I'd love for us to kind of shift gears. You guys have both had such a great path, but also multiple roles in your career. And I'd love for us to have a conversation to open to either of you about kind of what are the multiple different ways that a social worker can either be part of, substance use treatment or part of the supports for individuals with substance use disorder. What are the kinds of roles that social workers can have?
I can cover the macro piece, Amy, if you want. Okay, so from the macro perspective, as social workers, we're uniquely positioned to be this connector between folks with lived experience and the people who get to make the decisions. So one of the major issues with most social issues that we face in society is that the people who have the power and the capability to make a lot of changes to our systems and our structures are not necessarily folks that have lived experience about the issues that they're creating policies and legislation that are going to be addressing these issues. So for us, as social workers who are on the ground, we can make sure that we're connecting people with lived experience to folks who want to learn more about what it's like, because data around issues is powerful, but data combined with stories and real people who live this experience on a daily basis are what is, shown to be very effective in terms of moving legislators and pushing policy and advancing agendas. So like right now, the Biden administration in their State of the Union and their plans for the upcoming years has talked a lot about harm reduction and changing the way we think about treatment, the way that we treat people with substance use disorder in society, and really understanding that we just want to keep people alive. And so every opportunity that we have to give a person another chance to make it happen is worth it, because people are worth it inherently as human beings. So that's where I feel like from a macro perspective, social workers can really start to do this, is to understand the lived experience, connect that to people in power who get to make a lot of these funding decisions around the work that we do and the money that will go towards programs for people with substance use disorder. And to also be the person creating these policies, right? Like I think a lot of the times we think social workers are clinical, but part of the social aspect and what separates us from, say, like a psychologist or even mental health counselor is the social aspect across different systems levels. So we need to be doing more of that advocacy work, community building, and thinking about how we're changing agencies and sort of these larger structures to accommodate the lived experience and realities of folks. Because for when I was working in prison, will is not going to get you the housing that you need or the job that you need. You can work very, very hard and still never get there. So it's really these policy barriers a lot of the times that are preventing people from, self-actualization, from wellness, from being the best that they can be.
Yeah. And that's often things like, quarries and that get in folks' way from, employment and things that are going to support their long-term recovery, which are just as important as the treatment components, right? You have to have.
It's all connected. Yeah. If you don't have a roof over your head, right? It doesn't matter if you're abstinent, because things aren't going to be like great for you.
And on the micro end, I think one of the first things that we do really every day, I hope, is starting with combating stigma. So for individuals coming into one of our methadone treatment programs, sometimes there's some shame with that, or they have family members or friends who are saying, oh, don't go on methadone. You don't need to be on methadone. But they know that they do. And so when they come in, it's really a matter of setting the tone for that treatment and kind of changing people's thoughts about methadone clinics. when they come in, just greeting people and saying good morning and how are you, and knowing the patients by their first name. Those kinds of things can help people feel comfortable walking in to get that micro level of treatment and to do their clinical work. So just, that's one of the first things that I think about, is setting that tone for, this is treatment. This is a place where you're going to grow and hopefully meet the goals that you've come here for. We do intensive therapy with people. We base it on their individual need, but for a lot of folks in the beginning, that looks like weekly therapy sessions. And sometimes people will say, well, DCF or probation, they say I need a therapist. It's so great to be able to say, I am a therapist. So this is great. You're here in treatment with us, and our treatment is focusing on substance use, but it's not limited to that. What we're doing is really all encompassing, and it's multifaceted. So many of our folks have co-occurring mental health disorders. And so we can work on that and we can treat that. So in the micro end, we really emphasize best practice. We look at evidence-based treatment, providing that treatment to the clients, giving them skills that are going to transfer across their mental health disorders, across the substance use disorders, is something that I think is really important on the micro end. Another thing that we're really emphasizing is the use of care teams. And as a social worker, as you mentioned, Taylor, we're all about systems and interfacing. So we've got this care team approach, and we're looking at how do we integrate ourselves more into just traditional care? How do we be seen as legitimate as your primary care doctor, as important as your mental health counselor or your psychiatrist? So for us, I think a lot of it is education, is placing that phone call, sending the letter out to the doctor to say, hey, that your patient is also our patient, and these are some things that we'd love to talk about. Would you be able to join us? So kind of sending that message to our patients that this is a normal part of care, and this is a standard part of care, and we want to integrate with your team of providers. We don't have to be separate and siloed over here. We can include people, and you're probably going to get better outcomes when your team is able to really work with you and support you. And I think that's the heart of social work, is bringing those systems together. And for so many years, it feels like we were kind of siloed on this end, doing the substance abuse treatment, and everyone else is over here doing the other treatment. And it doesn't make sense because so much of our work is connected or overlap. So I think that's another piece, that just in providing good quality treatment, we're impacting the micro level, but also connecting on a broader systemic approach, which is, again, like the heart of what we do as social workers.
So it sounds like, you can in both sometimes, right? But you can be working on kind of those macro systems and, that micro approach with an individual person. But a lot of that has so much to do with connection, right? And making sure that those that make decisions about what healthcare looks like, right, as we, substance use disorders are part of that conversation, right? And they're not separated, or, you go take care of that first before you get care of the rest of your health. Like, let's take care of all of the things at once, and then supporting individuals on that path themselves, like pulling in their care team, and that there's opportunities to kind of do, all of that, within social work. So one of the things that I want to make sure we talk a little bit about before the end of our podcast today, and is something that's a passion of mine, having done work in substance use disorders for 23 years now, is that I don't think that most people who don't do this work know how rewarding it actually is, right? It's hard. It's challenging, right? It's not the easiest path, right? But it is really rewarding because people really do recover, and we really do see positive change. And so I don't know if either of you or both of you want to comment on kind of, sometimes it's that what's rewarding is what keeps us here, and keeps us doing this work. So if you want to comment on that at all.
Sure. So one of the theories around substance use is self-medication theory, which just sort of states that people engage in substance use as a way to soothe or cope with things that they've experienced or dealt with. And so I think that trauma piece, in the piece of trauma doesn't necessarily have to be a traumatic experience, one thing per se, but also the trauma of living in poverty or living with parents that have mental illness or being food insecure, right? So all of these things. And really just working with people to push back against this other theory of substance use, which is it's a moral failing, right? There's just something less than about you that, I took opioids and I didn't become addicted. So why couldn't that, if you had tried harder, then you would be abstinent, or all these other things. And so for me, I feel like it's very liberating to work with people and to say, like, this is a tool that worked for you at some point, for most people, that this was something that was helping you cope with something else that you've been through or dealt with. And we need to help find other ways to deal with that, because we can't go back in the past and take away something that's happened. What we can do is figure out what are less harmful, healthier ways, or more protective ways that are going to help you sort of move on with your wellness and your life, other than substance use and misuse that maybe isn't working for you in the same ways that it used to years ago when you began doing this. So I feel like it's liberating for all of us to think about the fact that we've experienced like crappy things or things that are like really impactful for us in a negative way. And that a lot of the times we're just doing our best to deal with that. And that getting through to people to say, like, it's not just you not trying hard enough. It's not that you're less than, but that this is the society we live in and we're using the tools that we have available to us to cope. That's what makes me keep going, I think.
And Amy, how about you?
I think from working in the OTPs, again, I'll go back to the stigma. One of the most rewarding things is when you see a shift in your patient. Again, so many people walk in and their head is down and they feel ashamed that they're coming into treatment. And that's just so unfortunate because it's such a great thing that they recognize, hey, this is what I need right now. And they've come to us. So I think when we, again, set that tone and really welcome them in and help them see that this isn't just a place you come to medicate, this is a treatment center, you can see that shift and you can see them kind of come in and really start integrating into the program. So that's something that's really rewarding, and it can happen pretty quickly where you see people starting to feel better and kind of say like, okay, I'm really ready to do this. When you see people who come in and they're so sick from withdrawal, and within a couple of short weeks, you see them physically starting to feel better and their withdrawal symptoms are alleviated and they have more energy and there's a change in their presentation and their overall demeanor and they look like they're feeling better. That's really rewarding, and that can happen pretty quickly. And you don't see a lot of quick change like that in this field. So that's one of the things that's kind of more instant when you realize, okay, people are starting to feel better already, and now we're going to dive into the real clinical work, which is fun. Lisa and I have been talking before about how some of our patients stay with us for quite some time, and while that might kind of seem strange to people, for us, that's normal. That's a part of treatment. Why are we going to rush it? Especially when it's working. That's a great reason to stay engaged and keep working on your goals. So you really get to see your patients grow and develop and change over a period of time. And you don't always get that in every kind of treatment setting. We have many patients who they might choose to leave treatment for different reasons, but when they return, every single time is a new opportunity. And so we welcome them back and we start again and kind of build from where we were before. So you really get to see change and growth, and you can see that it doesn't matter if you've been here once or twice or 10 times or 30 times. This is the time that could be your best. And this is the time that you could really make the changes that you set out to make. So I think you get to see growth and change over a period of time. And sometimes it takes time. But I think we bring a sense of hope to them because every time they come back in, it's welcome back. We're so happy to see you. Where would you like to start? So you really get to see people change and hopefully instill that hope in them that we believe it's possible. And when we can see that they're starting to believe it too and actually make change, I don't know if there's anything more rewarding than that in this field.
And I will say that, I've been doing this podcast for, it's probably, it'll be 2 years in June. And I don't think we've had a single episode where the idea of hope has not come up in some way, shape, or form. And I think that instilling that idea of hope in individuals, instilling the idea of hope in families, right, who are going through and walking this path with their loved ones, right, and even instilling hope in systems, right, like helping inform the systems that there actually is hope. And so if we change how we build the system, that we might see something different, right, and social work just has such a place for that. So before we kind of end, I really wanted to kind of just get your perspectives on anybody that's listening, right, that's either interested in entering social work, right, Because maybe they haven't found that spark when they're sitting in classes or talking about what they might want to do with their lives, or aren't really sure, or, considering a career shift, whatever that might be. Or even if you're already committed to doing social work, like how would you suggest folks kind of move towards working in substance use disorders?
I think the first thing that I would say is don't think that it's too hard. I think a lot of people say, "Oh, I could never work with that population. That's not for me, or that's too hard." It doesn't matter where you work. You're going to see substance use disorders and you're going to be involved in treating them. So don't assume that it's too hard or you can't do it or that it's not rewarding. It really is, and it's challenging. And that's why we came into this field. No matter what you do in this field, it's going to be challenging. So I think just recognizing that and believing that there's a lot of change that you can affect. And even if it is challenging at times, that's why we're here, and that's okay. So that would be the thing that I would say, is tell yourself that it's okay to give it a shot. And a lot of the skills and the theories and the techniques that you use in this form of treatment are very similar to what you'd use in any other venue. So you can do it, and don't shy away from the challenge of it. It's really worth it.
I love that so much. Yeah. I think the time is ripe. We're at a place right now where, specifically around behavioral health care, so like substance use, mental health, trauma work, we have a shortage of workers. So if you're interested, now is the time, because you can probably get your training paid for. And there are so many job opportunities that are waiting for you. So if you want to change for something that feels maybe more meaningful, I would say give it a shot. The worst thing that can happen is that you don't think it's a good fit, but there's so many opportunities right now for folks who are interested in getting involved in human services work, specifically around behavioral health with substance use, mental health, and trauma.
I think that's such a great point, right? And that system change probably started with a social worker, right? Like that ability to, recognize the workforce shortages and start to enact those changes that might allow kind of the challenges of, the cost of school and loans and those things to be mitigated, right? So, I think that's kind of a great way for us to move towards wrap up here. So, I didn't prep either of you for this conversation, mostly because I don't have my co-host with me, who's will be back next month. For anybody that's wondering where Jesse is, he will be back next month. But we do tend to wrap up our podcasts with any suggestions for either a resource, a book, a podcast, kind of anything that it can be kind of something that you personally appreciate, or that you think is really relevant to kind of what we're talking about today. So, no pressure, but if there's any kind of resource or support that you might want to share, we kind of keep a running list of what our guests, bring to us.
So I have a recommendation from Carl Hart, who is a psychiatrist from Columbia University. It's called Drug Use for Grownups. And so he's a person who's been very vocal about his substance use as a tenured professor, and just changing the narrative around substance use in our communities. So if you're interested in learning more about a new perspective around harm reduction and stigma and bias, Drug Use for Grownups, I think, is a great plug. And if you're wanting to know more about harm reduction practice, I'm trying to find, so it's called Over the Influence, the Harm Reduction Guide to Controlling Your Substance Use. And so it is written from the perspective of someone who's in active addiction, who's looking to find ways to decrease the harm in their life from their addiction. And it's by Pat Denning and Jeannie Little.
Those are such great resources. Thanks so much. And I really appreciate kind of that harm reduction perspective.
A resource that came to mind for me was actually more for people who are thinking about entering the fields. Taylor, you kind of alluded to different systems and trainings, and I'm thinking about public service loan forgiveness. If anyone is interested in doing work in the field of addiction, there's lots of places that you can work and get public service loan forgiveness after a period of time. So for people who might be thinking about doing addiction work, but not sure if it qualifies for that, there's tons of agencies that absolutely fall under that umbrella. And it's a great resource for people who have loans and really need to think about that as they're maybe starting their career search and looking for the right employment, that's something you can definitely look into and know that in this field, there's lots of places where you can qualify for that benefit.
And, for many of them, even working at places like Spectrum Mentoring and Recovery Center as a nonprofit, right, would qualify that. We've got some HRSA approved specific locations, but there's also, a lot of shifts in what is allowable for loan forgiveness now. So definitely kind of taking a look at that. So whether you're entering or going through the path of social work, or you're working in the field, right, and we're recognizing you this month, even if you had gotten a no before, right, that maybe your loan might not be forgiven, the answer might be different now. And so definitely check that out, because I think all of us working in this field, could benefit from that support for sure. So that's a really great resource. Thanks for saying that. All right. Well, this has been super fun. So I want to wish you both a happy National Social Workers Month. Listen, wish all of our listeners. I really it was important to have this topic to talk about kind of what the role of social work is. And because of that shortage, right, that because there just aren't enough people even entering the field, and the needs have not shifted, but the opportunities to work in this field have grown. And so I think it's just been a fantastic episode. I really appreciate both of your perspectives. Thanks so much for joining us.
Thank you, Lisa.
Thank
Thank you, Amy.
Thank you very much.